Welcome to our tutorial on TRICARE for Life hospice coverage. What is hospice care? Hospice is a specialized type of care for those facing a life-limiting illness and for their families and caregivers. Hospice care addresses the patient's physical, emotional, social, and spiritual needs. It also helps the patient's family and caregivers. Hospice care takes place in the patient's home or in a home-like setting. In hospice, the focus is on managing a patient's pain and other symptoms so that the patient may live as comfortably as possible and make the most of the time that remains. The purpose of hospice care is to emphasize that quality of life is as important as length of life. TRICARE covers hospice care in the United States and U.S. territories. Hospice care is not covered in other countries. Hospice care can be initiated by you, your primary physician, or authorized members of the family. Your doctor orders hospice care. You will complete an election statement, which you will give to the hospice provider. The hospice provider will file the election statement with your regional contractor. The TRICARE Hospice benefit covers supportive services including pain control and counseling. The benefit also covers home health aid services and personal comfort items. TRICARE's hospice coverage also includes unrelated conditions such as broken bones or diabetes. There are things that TRICARE Hospice care does not cover. For example, room and board is not covered except for inpatient or respite care. The care for the illness is not covered by TRICARE unless the hospice provides or arranges for the care. If you cancel your hospice care, you may get other TRICARE services or benefits. Those under 21 years old may receive both hospice care and other benefits. TRICARE provides hospice care in 3 benefit periods. Period 1 and Period 2 each last for 90 days. Period 3 extends for an unlimited number of 60-day periods. You will need pre-authorization for each benefit period. Each 60-day period requires recertification of your terminal illness. You will give up any remaining days in that period if you cancel hospice care. For those under 21 who are getting concurrent hospice services and curative care, these benefit periods do not apply. The TRICARE Hospice benefit offers 4 levels of care: continuous home care, general hospice inpatient care, inpatient respite care, or routine home care. What types of care are covered under TRICARE? Care within each level of coverage may include physician services, nursing care, counseling, medical equipment and supplies, medications, medical social services, physical and occupational services, short-term inpatient care, and speech and language pathology. To cancel hospice coverage, submit a signed and dated statement to your hospice care provider. You will lose any remaining days in that period when you cancel hospice care. You may elect hospice coverage for any election period at any time. We hope this tutorial on TRICARE's hospice care benefit was helpful to you. Please follow us on Twitter, like us on Facebook, and look for our other upcoming tutorials. Thank you.